Video, we are going to learn about second generation and third generation macrolides. This video is a continuation to the video in which we talked about the general features of macrolides and the first generation macrolide, that is erythromycin. The name of the video is Macrolides Part 1, and I would highly recommend you to watch that video before watching this one. Now let us start with clarithromycin. The spectrum of clarithromycin is more or less the same as that of erythromycin, but additionally it is effective against Mycobacterium avium complex or MAC, Helicobacter pylori, Mycoplasma pneumoniae, Mycobacterium leprae. Remember these organisms well so that you will easily be able to write the uses of clarithromycin. I'll show you how in a while. Coming to the pharmacokinetics, clarithromycin is more acid stable than erythromycin. Also, it is rapidly absorbed and its oral bioavailability is around 50%, more than that of erythromycin, which was around 30 to 40%, if you remember. It also undergoes first pass metabolism, and food may delay its absorption. Clarithromycin has a larger tissue distribution and no dose modification is required in cases of liver and kidney failure. Coming to the uses of clarithromycin, from MAC we can say that it is used for the prophylaxis of MAC. From Helicobacter pylori we can remember that it eradicates Helicobacter pylori. From Mycoplasma pneumoniae we can say that it is effective against atypical pneumonia. From Mycobacterium leprae, we can remember that it is a second line drug against leprosy. Additionally, it is effective against upper and lower respiratory tract infections. The adverse effects of clarithromycin are similar to that of erythromycin. We covered it in Macrolides 1. Let me help you recall. The adverse effects, we learnt them with the help of the mnemonic macro, where A stood for motilin receptors in the GIT, which when they got stimulated led to diarrhea. A stood for allergy, C stood for cholestatic jaundice, and R and O together stood for reversible ototoxicity. Now let us move. Clarithromycin is also a microsomal enzyme inhibitor, which means that if an other drug is given along with clarithromycin will slow down the metabolism of the other drug, which may lead to the cause of toxicity of the other drug in the body, and it will lead to the accumulation of the drug and it will be slowly excreted from the body. Now moving on to azithromycin. The spectrum of azithromycin can be remembered with the help of the mnemonic chart, where C stands for chlamydia, H stands for Haemophilus influenzae, A stands for the A in Mycobacterium avium complex, T stands for the organism Toxoplasma gondii. Additionally, azithromycin is also highly active against respiratory pathogens. Coming to the pharmacokinetics, azithromycin is rapidly absorbed orally and it has a high acid stability. It is highly distributed in our body, well distributed in our body, and it has better tissue penetration. An important point about azithromycin is that it has a higher concentration in tissues than in plasma, and the drug is slowly released from the tissues, which provides it an elimination half-life of around 3 days. Its half-life is around 2 to 4 days, which can be remembered as 3 days. The drug is excreted 90% through bile and 10% through the kidneys. Azithromycin is the first choice drug against Chlamydia trachomatis, which causes UTI, Legionnaires pneumonia, cancroid. Also, it is active against respiratory pathogens, so we can remember that it can be used in conditions like pharyngitis, tonsillitis, and chronic bronchitis. Also, we just saw it is effective against MAC, so it can be used in the prophylaxis and treatment of MAC in AIDS patients. Also, it is effective against toxoplasmosis, A very important use of azithromycin is that it is used as a reserve drug against multi-drug resistant typhoid. Adverse effects of azithromycin are similar to erythromycin. I just mentioned them when we were talking about clarithromycin. Lastly, let us go to roxithromycin. A few points about it. It is also a semi-synthetic macrolide, but it is longer acting than its counterparts. Its spectrum is similar to erythromycin. In fact, roxithromycin itself is used as an alternative to erythromycin. The conditions in which it is active is respiratory, ENT, skin, and soft tissue infections. Also, it is effective against genital infections. Lastly, a few points about telithromycin. We need not go into much detail about this third generation macrolide. So yeah, let me tell you a few points about it. This drug is effective against community acquired pneumonia or CAP, but it is not used a lot nowadays because it has significant side effects, the details of which it's better not to go into. So that is it for this video. I hope you gained something out of this video. Thank you so much for watching.